Hello everyone, my name is Ray. I'm a nurse practitioner who specializes in cardiology. And in today's video, I wanted to talk to you a little bit about high blood pressure or hypertension. It's actually called the silent killer. And the reason why they call it that is because most people don't feel that they have high blood pressure until they come into the hospital with a heart attack or stroke, God forbid. But a lot of times we see patients that come to the hospital complaining of things like chest pain, blurred vision, dizziness. There's a lot of different manifestations, headaches, a lot of manifestations for high blood pressure. But believe it or not, a lot of times we're telling people for the first time that they have high blood pressure. Now, with that being said, we don't typically diagnose somebody with high blood pressure based off of one or two elevated blood pressures. By the way, the goal that you're shooting for is under 130/80. But sometimes patients come in and they have blood pressures in greater than 200s. It's pretty safe to say they probably have high blood pressure and they've had it, for a long time. So what we do in that situation is we start telling people that they need to start monitoring their blood pressure on a daily basis. The easiest way to do that, besides going to your primary care provider, but I know especially fellas, they're kind of stubborn and hard-headed and don't want to see the doctors, but listen to your wives, fellas. But the best way to do that, what we tell people when they get out of the hospital, is go get yourself a cuff at home that you can use. You can get at Walmart, Walgreens, things like that. They're about $40 or $50. Company that I like is called Omron, Omron. And basically what you do is you start checking your blood pressure on a daily basis in the morning, same time. When you first get up, go to the bathroom, do your business, pee, whatever, number two. Sit down, wait 5 minutes, keep your legs uncrossed, relax, and then check it. And then keep a log of what your blood pressures are running. 9 times out of 10, when we see somebody in the hospital for the first time with high blood pressure, we're going to start them on some blood pressure medications. Sometimes we get it just right, but most of the time we may need to make some adjustments. Sometimes you need more blood pressure medication, sometimes you need less. So what I do encourage all my patients that we're diagnosing for the first time with high blood pressure is to start checking it on a consistent basis every morning, like we mentioned. Then we have the data. And then, when you follow up with either your PCP or depending on what happens in the hospital, if you follow up with us in cardiology, then we'll take a look at that log, and then, we'll have some information that we can help determine, whether we need to adjust the medications up or down. Send this to someone that you know that needs to get their blood pressure checked, and make sure that you like and subscribe to the channel for more information like this. See you in the next video. Bye-bye.